Welcome back to the Piscataway African American Seniors Club Black History Celebration, Black Health and Wellness Journey 2022. I am Sherlyn Mears. We open today's show with our founder, Ida Anderson, sharing her poetic work called Toolbox.
From my mental toolbox to society comes the password responsibility. This word is for me and for you in the year of 2022. This year there is a little more advice. Many will heed, others won't think twice. But we'll go forward with a short review. Some may remember, others who have forgotten may number quite a few. 1 year in the toolbox, we talked about acceptance of the color of one's skin and noted that's where society solutions should begin. Another time, we talked about togetherness as a catalyst for social change, which took hold as a solution in our problem-solving range. Reaching back in our mental toolbox for the year 2022, here's an inclusive brainstorming subject for me and for you. The timeless subject is responsibility, a therapeutic password, a sure enough working key. We are responsible for each other all around the globe. It doesn't matter who we are or where on this earth we abode. We seem to forget that wherever we go, our safety is at stake. When we step off the curb into life, we can easily make a grave mistake. We need to be more careful about what we do or say and try not to offend one another as we move from day to day. Sometimes it seems we awaken with an insulting attitude, and we are reluctant to thank God for his provisions with a heart of attitude. But I found that in this life, we should find favor if we greet each other and each day with joy and take time being an acceptable example for each young girl or boy. This responsible attitude should always be with us, whether we are on the boat, airplane, train, car, or even on the bus. We should take the responsibility to protect each other's health and realize that this responsibility is not dictated by wealth. You have no special privilege to negatively impact my space, even if you feel you have an assigned privileged face. No one, it is said, is above the given law, but individually, in many, we find this definite, identifiable character flaw. Individually and collectively, let's do a character check and make changes as our responsibility to others we correct. In this moment of time, the health crisis is not determined by the color of the skin. We need to realize that this climate change and air-carrying disease is without and within. Let's consider our responsibility to each other's space and place, and we greet and meet each other face to face. This is a brainstorming tool we can all use in our daily walk, and we can use it in our communities and in our private and in our public walk. Now, as we get together, let us stand and sing together, lift every voice, and have the responsibility to sing that song by choice. Then together we can proudly sing, "My country, 'tis of thee." Why? Because we have individually and collectively accepted responsibility as today's password. Today's password. Today's password. We have proudly accepted responsibility as the password for this day and time. Thank you for listening.
Hello, and welcome to our program. My name is Diana Motley, and I'm the chairperson of the Black History Committee for the Piscataway African American Senior Center. Today, I have the pleasure and honor of introducing to you Zaire Ali and Omar Clark of the Urban Health Collaborative, who will give us a presentation on mental health hygiene. So let's listen, be informed, and enjoy.
My name is Zaire Ali, and this is Omar Clark. And today you're going to learn a little bit more about us, but I wanted to give each of us a proper chance to introduce ourselves.
So I'm Omar Kenyatta Clark. I'm so excited to speak with you all today. I'm the program director at the Urban Health Collaboratives. I hold a bachelor's degree in psychology, and I am currently a doctoral candidate in clinical psychology at Rutgers University.
And fun fact, that's how Omar and I met. We were classmates at Rutgers doing our doctorates, and now we're here, teammates.
Yeah.
And as I said earlier, my name is Zaire Ali. I'm the Executive Director of Urban Health Collaborative. I'm local. I was born and raised in Plainfield, New Jersey. I currently hold a master's degree in public health and education. I'm a current PhD student. And to tell you all who don't know who we are and about the organization, the Urban Health Collaborative, we really try to help. How would I say this? We do a lot of things, but the main thing that we do is we try to help shift mindsets and really help the world believe it can be a better place. And we do that by collaborating with local, state, and federal organizations around mental health, community health, mental health hygiene. And we really just strive to overall improve the well-being of communities, especially urban communities in the United States. Our focus has been right now central New Jersey and northern New Jersey, hence Piscataway, Plainfield, North Brunswick, New Brunswick. Those are the communities we serve. And we really just want to touch the community, meet you all where you're at, and give you all, resources and just help to get out of bad places, dark places, and to find that light to keep going with a smile on. And the agenda for today is we're going to go over what is mental health. We're going to go over COVID-19 and how that had an impact on mental health. We're going to go over some of the most common mental health illnesses in America. We're going to go over a few risk factors that impact our mental health. What is mental health hygiene? And we're going to lastly show you all how to just be resilient and stay healthy during the COVID-19 pandemic, because we are still living in it right now.
All right. So what is mental health? We hear this term thrown around a lot, but what it is, it's our emotional, psychological, and social well-being. Okay, so our mental health influences, how we think, feel, our behavior, how we handle stress, make decisions, and so much more. So some anxiety facts. All right, we'll just go through the list. Risk factors for anxiety, there's genetics, brain chemistry, and then life events. So biologically, there's risk factors as well as social environmental risk factors as well. Okay, 40 million American adults have anxiety disorder, which is a very high number. It's a common disorder. And even if it doesn't reach the level of a disorder, we can still feel anxiety. And I don't want to downplay that as well. We can feel anxiety just if you have to take a test,
Sure.
Or, you have a job interview, you can feel anxiety, So throughout this presentation, we'll talk about ways to combat that and, how to resolve those type of feelings. Another fact, women are twice as likely as men to have anxiety disorders. So that's a more vulnerable population, to be aware of, But even though all these people are suffering from anxiety, only 36.9% of people affected actually seek treatment,
That's stark, and that's scary, because those are just the people who are known and diagnosed. So imagine all of the people out here, and especially in urban communities, black and brown folks, or even just lower income white people. They might be feeling the same thing. But if you don't know to get checked, or you don't know what anxiety might feel like or what it looks like, how are you going to even know to ask somebody what it is?
So now we're going to move on into depression, okay, which is another common mental illness that we all suffer from to varying degrees. So we have a definition here of what depression actually is. Mm-hmm. Okay, so depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called major depressive disorder or clinical depression. It affects how you feel, how you think, behave, and can lead to a variety of emotional and physical problems. That's a point that I just want to talk about really quick, is how, our mind has such an effect on our physical body, So like with depression, it's emotional, it's affecting your mood, you feel sad, you have a loss of interest, but also like it's people who are severely depressed, can't even get out of bed in the morning. That's how serious it is. It affects you physically as well.
So it sounds like you're saying if I have major depression or somebody's just feeling depressed, it might look like they're lazy, or it might look like they have no motivation in life. But like you were saying, this is something inside. So this is something I can't see, you can't see,
Exactly.
but we might be dealing with. Is that what you're saying?
Yeah, absolutely. You know.
So if I'm depressed and nobody sees it, and I'm just eating a lot of sweets, what does that might look like? Oh, I just like sugar and I don't take care of myself. But no, maybe eating these candies and eating these sweets is the only way a person with depression might feel a little normal or just feel happy for that moment. So I don't know. How does that sound? Does that sound like depression?
Right, exactly. So with like depression, like we can't see it. We can't see your sadness. You know, it's invisible.
Okay.
Right. But we can see the behaviors, like you said, the eating the sugary drinks, not looking as if you're lazy, not doing things. You know, those are the physical manifestations of depression. But what we can't see is people's subjective experience. You know, that sadness, the loss of interest, you know, what is going on in here and in here. You know, we can't see that.
Thank you, Omar. Right. I learned something new today.
So some more facts. So an estimated 19.4 million adults in the United States had at least one major depressive episode in 2019. Okay, and this number represents 7.8% of all U.S. adults. Okay, and then with adult females, it's 9.6% compared to males, which is 6%. Okay, the prevalence of major depressive episodes was highest among those who report having multiple races or from different ethnicities.
So Omar, I'm just curious. You told me a lot of things. You told people a lot of things. So what actually happens when we neglect our mental health? Can you tell me a couple things?
So when we neglect our mental health, it can also have an effect on our physical health. And when we neglect our mental health, it can affect how we feel inside, our mood. When we neglect our mental health, we can have sleep disturbances. We can have strains on our relationships. A decrease in productivity. So you may not work as well. You may not be able to be productive at work.
Or how does it look like if you're at home? Let's say, I'm a stay-at-home dad, and my productivity levels are low. What does that look like?
Yeah, so you won't be able to do the things around the house. You won't be able to feed your kids. You just won't be able to do the thing that you normally would be able to do.
Wow, and that's just because I'm not taking care of my mental health.
Yeah.
Okay, Omar. So that's interesting to know. So you're telling me that, like we saw earlier, women are 2 times that higher for anxiety and are a higher risk for depression. So you're saying if they're at home and they're dealing with this and there's nobody to talk to, they're just festering with that inside?
Yes, and that actually, I like your word, exacerbates the issue, because all humans, we are all social creatures.
Okay.
So if we are isolated and we don't have anyone to talk to be social with, our mental health is going to deteriorate.
But if I'm at home, my kids are playing around, I'm talking to them, right? If they're crying and I'm like, I'm talking to somebody, aren't I?
That's not the same communication that, we're looking for. Communication where it's a two-way street.
Okay.
In that way, or because with your children, they're not able, you can't really tell them your true emotions, and put that on them, because they're your children.
I like that.
Yeah.
Okay, Omar. So as you said earlier, how do we do this? And we're going to go over mental health hygiene and just introduce that.
Okay, so what is mental hygiene? It's all the activities and techniques which maintain mental health and assist in preventing the development of mental illness and comorbidities.
Okay.
Yeah.
So some examples of mental health hygiene are just daily exercise routines.
Yes.
A consistent sleep schedule.
Yes.
Daily meditation, or just being grateful, and actually just not doing anything, just finding time to do nothing.
Right. So what are the benefits of mental health hygiene? You can have improved mood, clearer thinking, a reduction in anxiety, increased self-esteem, improvement of relationships, a greater sense of self-worth or inner peace. And it helps reduce the risk of the onset of depression.
And some other ways to really think about this are community-based interventions. So there are school programs, there are community centers, there's community counseling, there's elderly centers, senior citizen centers, there's youth centers. So communities have all that. And prioritizing your relationships is another one. Just surrounding yourself with great people like Omar, he's a great guy. He's one of my good friends and colleagues. So creating these support groups to help yourself.
Yeah, and like we said, we are social creatures. So we need to develop social support networks. So therapists and counselors, like myself, help people develop coping skills and an overall better state of mind, to build resilience,
And, you all are part of this great community Piscataway. Check out the resources. There's a lot of things going on here. And just being active, like Omar said, physical activity. It organizes your brain, helps you with anxiety, helps with depression, and it reduces stress and anxiety.
Yeah. And so important is making time for self-care. Oftentimes we're so busy, trying to help someone else, we forget about ourselves. So things like just staying hydrated, eating healthy, taking care of your physical body, getting the sleep that you need, exercising or relaxing, any of those things, just to take care of yourself.
If you have any questions, please reach us on our website at www.theurbanhealthcollaborative.com.
Wow, that was very informative. We see how our mental health also impacts our physical health. In fact, I have a trivia question for you. True or false? It is possible to die of a broken heart. Just think about that for a moment. Well, the answer is actually true. In fact, a Japanese scientist named the condition broken heart syndrome, and he found that emotions such as fear, anger, and depression can have negative impacts on our heart and can lead to death if we don't address these emotions in the long run and get them resolved. So now I wish to say a few words about African Americans and heart disease. As many of you may know, heart disease is the #1 killer of all Americans, and stroke is also a leading cause of death. According to the American College of Cardiology, for data collected in 2018, African Americans had the highest rates of cardiovascular disease in the United States, with approximately 47% affected. African Americans are also 2 to 3 times as likely as whites to die of heart diseases. Contributory factors of cardiovascular diseases are obesity, diabetes, and stressful lifestyles. African Americans experience additional stress due to the wear and tear of racism. Studies conducted over time have consistently shown that racism not only impacts social mobility, but it also impacts the ability of African Americans to be mentally and physically healthy. As for obesity, Black women have very high rates of obesity in the United States, followed by Black men. According to the American Heart Association, for data collected in 2015, approximately 69% of African American men over 20 were either overweight or obese, and approximately 82% of African American women in the same age group were either overweight or obese. There are also differences in treatment patterns based on sex and ethnicity. Women and Blacks are less likely to get aggressive treatments when presented with chest pains. Some reasons for racial and ethnic disparities in treatments are socioeconomic status, physical environment, access to care, and social support. Many healthcare professionals have little or no awareness of racial, ethnic, and sex-based disparities. In addition, many cardiac specialists tend to be white men. Blacks have higher rates of heart failure than whites, with the highest risk in Black women, according to the American College of Cardiology. Heart failure in Black patients is more likely to stem from high blood pressure than coronary artery disease. According to the American College of Cardiology, Blacks in the United States had the highest rate of hypertension in the world, with a prevalence of approximately 41% based on 2011 to 2014 data. Blacks also tend to be more salt sensitive. For this reason, the DASH diet is very helpful for blacks. DASH stands for Dietary Approaches to Stop Hypertension. The DASH diet includes foods that are rich in potassium, calcium, and magnesium. This diet is also rich in vegetables, fruits, and whole grains. It includes fat-free or low-dairy products. It includes fish, poultry, beans, and nuts, and limits foods that are high in sodium and saturated fat. Diabetes in women seems to be a stronger risk factor for cardiovascular diseases than men. One study found out that women with the disease had a 44% higher risk of cardiovascular disease and a 27% higher risk of stroke than men. In summary, we as African Americans can improve our odds of preventing and beating heart disease and stroke by doing the following. Get physical checkups and be aggressive about our health care. Work with our doctors on our specific risk factors. If we suffer from high blood pressure, take blood pressure medications and make lifestyle changes. Keep track of changes in our blood pressures and have our blood pressures checked regularly. If we suffer from being overweight, obese, or diabetic, walk at least 15 minutes a day and follow a diet limiting sugary drinks and desserts. Limit red meat in favor of lean meats such as chicken and fish. Watch portions of foods high in carbohydrates such as pasta and rice. Use whole grains instead. Make vegetables the main portion of the meal. If thirsty, drink water instead of juice. And finally, guard our mental health and pursue good mental health hygiene. Extreme emotional or traumatic events can trigger surges in stress hormones, which can put us in short-term heart failure and be life-threatening. People with depression have an increased likelihood of developing heart disease and vice versa. Negative emotions can cause blood pressure to rise, increase vascular reactivity, and the likelihood of blood clots. On the flip side, positive emotions can help people with heart disease live longer. People with strong networks and close emotional ties to others have less heart disease and tend to fare better if they do develop heart disease. So let us all pursue these healthy lifestyle practices and increase our chances of having healthy hearts. Thank you so much for your time. Hi, this is Diana Motley again. I have another trivia question for you. In preparation for a blood test, what is the best thing to do? A, exercise, B, drink water, or C, take vitamins? Let me go over that again. Is it A, exercise, B, drink water, or C, take vitamins? Okay, let's think about that. Actually, the best thing to do is B, drink water. Drinking water helps keep more fluid in your veins, which makes it easier to draw blood. Food, drinks other than water, some vitamins, and strenuous exercise can all lead to inaccurate blood test results. So remember, the best thing to do in preparation for a blood test is to drink water. Thank you.
Hello. Thank you for tuning into our program today, and we look forward to seeing you next week.